Folks, thanks for coming on the line with us today. My name's John Dubas with the Brokerage Incorporated here in Louisville, Texas, and we'll be spending the next half hour to 45 minutes or so going through an informational piece for you, combining a couple of different sources that allow you to perhaps grasp some of the finer points or even the basics of Medicare, so you can feel comfortable in explaining the program to prospects and clients, and give you then an idea of some tools that are available for you to use during informational seminars or meetings that you might have on the topic. What you have on the screen right now is a bit of a sister site to Medicare.gov. This is CMS.gov, and it has a repository of information for you to use compliantly in helping to educate others about the programs that we're going to discuss, the different Medicare programs. I'm also going to use one of our carrier partners pieces for a couple of different reasons, and that is the United Healthcare programs that they make available through Medicare Made Clear. I do that for two different purposes. One, United Healthcare is a big gorilla in the marketplace and is something you need in your pocket, obviously. But two, these pieces, while they are branded with the United Healthcare logo, are generic in nature, and they make the collateral material available to you without cost. Yeah, in the Medicare world, probably the only time I can say free. So you have the opportunity to use the material, and we can help you with different pieces on how to make that a part of your overall presentation and your marketing scheme in a manner of fashion, your marketing plan. When you go to CMS.gov, you have a bunch of information available to you. Some really cool research on statistics and systems that are available to you, but you also have a number of things available through the Outreach and Education tab that are very helpful to you. Different topics that you can look up, different things about providers, some things on training and credit, events, different pieces, and tools you can use to help others. Going through that program then, it's like, wow, there's a bunch of stuff here for us, including information about Medicare open enrollment periods, different pieces that are there, but there are also different pieces that are available in their training program training library. And this gives you then an opportunity to have tools made available to you that you can use with the general public in a compliant fashion. A whole bunch of tools about different Medicare amounts. This is really kind of a neat piece here. Watch this. Shazam coming. Some basics that'll give you information on the specifics on costs that are involved with the Medicare program. Pretty neat. You can take and send that to yourself eventually. I have a lot of email, doesn't it appear? But then you can email that to yourself or just save it or print it. So some neat pieces that you can use there with specifics. You can also go to different pieces that talk about fraud and waste abuse prevention, information about DME, how benefits coordinate, how Medicaid and CHIP affect programs, information on MA plans, information for people who are disabled when we have to consider, hey, that's about 1/6 of the Medicare market, information on the prescription drug programs, on Medigap programs, and then you have programs that will help you with the basics of understanding Medicare. Keep in mind, this is a live site and it's still showing 2015 numbers and information, but you have that program information available to you, and wow, English and Spanish. What it does, is give us an opportunity to access information as current as is available in a PowerPoint that you can use with the general public. So this particular piece is the Understanding Medicare training presentation. Bear with me while it pulls up. And it gives you notes on how to walk through and explain the program as well. So Understanding Medicare is really a neat piece that you can use. You can also, by the way, get on their email list and they'll send you notifications of monthly trainings that they stage and help do that as well. So these pieces are right off of Understanding Medicare, right off of the CMS website. A great tool to use. The challenge is if you have to go old school with paper, well, these then need to be printed. And then that then draws in some expenses that come into play as well. So in addition to this training piece there, you've also got a piece on getting started with Medicare. So for those of you who work the turning 65 market, this is a great resource for you to use and reference as you go through and stage different events in the community as you become comfortable with the material. So a kind of an adjunct to the piece that we were just in there, gives specifics on the program and helps lay out some of the differences for you. I'm not going to use this as the presentation as a demonstration of the presentation today, but instead I'm going to go to a carrier who makes information available to you without cost that you can use with the public as well. So if you go to your UnitedHealthProducers.com website as a contracted agent with United, if you're not, we need to talk to you, contracted with United. Log in. This is the same site you go to in order to certify, order materials, those things. Log in. Think about it a minute. Go to the sales material category. Go to the agent toolkit either here or here. Access that. It's going to pop up in another window. So make sure you have your pop-up blocker off. And it gives you access to a ton of materials that they have available. And it gives you some shortcuts here on some different pieces. So their electronic presentation for the Holo Clarity presentation, which is for the MA plans, which keeps you compliant in that area so you can speak to the extra benefits. It also has the basic Medicare Made Clear materials. And when you go there, it gives you then access to a number of tools that are available. A guide for Medicare supplement programs, some of the basics on Medicare. These are materials that you can order and distribute, a piece on MA, the electronic presentation itself, flyers to help publicize events. They're branded. There's also a generic piece we're going to talk about in just a moment. And then a show me guide, which is about 1/3 of an inch thick, available to you without cost, that you can order in quantity, have shipped to your home or to your office, and distribute that through your meetings. When you use the presentation, it's thinking. You go through and pull it. This gives you an opportunity also to get the presenter notes. I've already pulled that down, so I'm going to show that to you in another window in a moment. But it then gives us the opportunity to feel comfortable and knowledgeable and conduct a presentation that is compliant. Add this to your shopping cart. Think for a moment. If you click the button right. And it'll download for you. Let me show you this really quickly. It says it's been added to my cart. Oh, dying on me here. Pardon me. But the other piece that you can use when it gives you access also to the presenter notes, it looks like this, basically. And it rolls through the presentation. So this is a nice piece in color, written in good old-fashioned American English, so to speak, and gives us a sales track, a speaking track, talking points that we can follow and help explain the basics of Medicare. So this is not how it would appear in the presentation piece, because it's just these windows that would show up, not the notes. So this gives us the opportunity to also use this as a study guide for ourselves. We speak to some of the top questions most folks have about Medicare as to who's eligible, what are your options, when can you enroll, what are your next steps, and if you're covered by Medicare, how can you save additional dollars and find the information to do so. It then speaks to some different categories. Nearly 50 million people on Medicare. That is dependent upon a date, and in this circumstance it's about 53 million, and about a sixth of that population is on Medicare under the age of 65. And so this is going to help people who are eligible for Medicare and answer a number of different questions. And when we speak to eligibility, it tells us that we are eligible for Medicare Parts A and B, original Medicare, if we're 65 years or older, or if we're under 65 and qualify on the basis of disability or special situation, and we've been a citizen or a legal resident in the U.S. for at least 5 consecutive years. If you or your spouse have contributed payroll taxes for Medicare through your working life, you're eligible for Medicare when you reach 65, regardless of your income or health status. Some things to know about that 65 rule. If you're already collecting Social Security, you must wait until you're 65 to enroll in Medicare, because you can post Social Security at 62. And it's individually based. You must be 65. Your spouse's age doesn't count. You roll into it at a time period based on your age. My mom and dad were 7 years apart. Dad got on Medicare 7 years before Mom. Mom was, oh my goodness, I got to stay on our individual health plan. Long time ago, pre-ACA, pre a bunch of stuff. But he's on the program 7 years before she is. And even if someone has decided to defer collection of Social Security benefits, they're eligible at age 65 to join Parts A and B anyway. The original parts, well, when your eligibility is based on age, you will receive a letter with your Medicare card from the federal government, and you need to follow the instructions on the back of that card if you want to defer Part B or deny it. Why would you want to do that? Well, there are reasons. We want to look at what those reasons might be. If you defer Part B, however, don't take it, and you don't have some sort of creditable coverage, you're going to be penalized financially for that decision. The coverage options that you have 4 different parts of Medicare that cover health-related services. Part A, Part B, Part C, and Part D. And then there's also something called Standardized Medicare Supplement Insurance Plans. We're going to talk about each of them in detail and look at the option that will best fit your healthcare needs and budget. Part A and B, well, this is original Medicare. And let's break down what the parts cover. Part A is sometimes called hospital coverage because it covers most inpatient services, including inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Some fast facts about Medicare Part A. Most people don't pay a monthly premium. You pay the deductible for the coverage. That's the first $1,200 $88 in 2016. It's for a hospital stay of less than 60 days. The enrollment in it is easy. You can't be turned down because of medical history or pre-existing condition, and it has some caveats that we need to be aware of. Long hospitalizations can be expensive. Stays of more than 60 days require a daily copayment that goes up, and multiple stays in the hospital may mean multiple deductibles. It's not an annual deductible, it's a per stay deductible based on when you go in and out of the hospital. And you can go to any qualified hospital, however, in the United States that accepts the Medicare patients, new Medicare patients. There are flexibility in that. They don't have to accept Medicare payments. Most hospitals do. And hospital care outside of the United States isn't usually covered. There are a few exceptions to it. The Part B coverage, it covers doctor and outpatient visits, and that includes physician services, outpatient hospital services. So just because a service is performed in the hospital and you're not admitted and it's considered outpatient, it's Part B, not Part A. It helps with the ambulance costs. It helps with outpatient mental health services, lab services, DME, durable medical equipment, things such as outpatient physical, occupational, and speech language therapy, and helps with some preventative care. It also has different things we need to be aware of when it comes to cost. It, like Part A, has no maximum out of pocket. So for some of you that are familiar with the Medicare Advantage plans, and we speak to MOOP, M-O-O-P, well, doesn't apply on traditional Medicare because, hey, you can keep paying as long as you keep drawing services. They don't cap what you have out of pocket. And generally, the coinsurance is 20% of the Medicare approved cost. It's not the standard cost that a provider would lay out for a service. It's what Medicare says they'll pay on that service. Part B does have a monthly premium that's determined by income. Most people have it deducted from their Social Security check. If you are one of the individuals who has chosen to defer their Social Security draw, well, they're going to charge you quarterly for it, and you can pay it that way. If you wait to join after your initial enrollment period, you may have to pay a higher premium for those coverages, and that is based on whether or not you have other circumstances that the government considers creditable coverage for Part B. The enrollment, once again, is easy. It's just a little bit of paperwork. The medical history or pre-existing conditions you might have doesn't matter when it comes to enrollment. The coverage itself works pretty much the same throughout the United States. You can get care wherever you are. Generally, care outside the United States is not covered. Some exceptions, Canada and Mexico. You get outside the 6-mile limit if you're on a cruise, you got some challenges. You need travel insurance or additional coverage someplace else. You can receive care from any participating physician who accepts new Medicare patients, and some preventative health care in this coverage is allowed as well and covered. The challenges that you have with traditional Medicare and Parts A and B is it doesn't cover all of your health care cost. You're still responsible for deductibles and coinsurance, premiums, excess charges, and prescription drug coverage. Additional benefits such as hearing and dental coverage, which we may be accustomed to through our working life, well, they may not be covered under original Medicare A and B. The Part C coverages are the Medicare Advantage plans. At one point in time, they were called Medicare Plus Choice plans back in the old days. These are single plans that are offered by private insurance companies that combine the coverage for original Medicare A and B and sometimes layer in and add the prescription drug coverage, the Part D we'll talk about next. Part C plans cover all of the Part A and Part B coverages that you have with traditional Medicare and rolls in the prescription drug coverage included in most of the plans. Not all of them. If you have a program that is an MA only plan, it is generally an opt-out of drug coverage, something to be careful with. Many of these programs will offer additional benefits such as routine eye care, vision care, hearing and wellness benefits, nurse health lines. Some of them even roll in a little bit of a health club benefit. To be eligible for this program, you have certain things you have to satisfy. You got to have Parts A and B. So you're not opting out of Medicare. You are directing who is going to administer your benefits. You have to live in an area where the plan is approved to operate. So the plan service area is very important. This program is also one where it's easy to enroll because your eligibility is not affected by your health or financial status most of the time. There are certain plans that the health status will qualify you for a special type of MA program, and there is one health question, and that is, do you have end-stage renal disease, ESRD? That is the only health condition that would keep you out of the programs for most of the circumstances, because there are some special rules for ESRD. Some of them might be available for coverage with ESRD through a Medicare Special Needs Plan, a chronic SNP, if there's one available in the area in which a person resides. Some additional facts about Medicare Part C. The plan premiums and the terms of the coverage can change from year to year, and the person on the program has to continue to have their Part B premium funded, either through their own circumstances or through assistance programs. Some of the neat points of the coverage is they have the convenience of one single plan. It's a card that is used when you go to the doctor, when you go to the hospital, or when you pick up your prescription drugs. And as we mentioned, many times that prescription drug coverage is rolled in right with the health coverage. And most cases, if you receive coverages, if you receive, in most plans, you receive your coverage based on the service area. And that means that much like where you're eligible for the program, that's where you receive your services. And in some of the plans, depending upon the platform in which the care is delivered, you've got to see doctors and hospitals and other providers that are part of the plan's network. Some of these programs will offer, many of them, additional benefits not covered by Medicare, such as dental, vision, hearing, fitness memberships, and additional full preventative care. You have different plan types that are available as part of Plan Part C programs. You have coordinated care programs, which will include HMOs and PPOs and the special needs plans, the SNP that we referred to earlier. You may even have a health maintenance organization with a point of service option available. There are a couple of other programs that are available in certain markets, and they include private fee-for-service programs and Medicare savings accounts. There are fewer and fewer of these available each and every year. A health maintenance organization that we referenced, well, that's a plan with a network of physicians, hospitals, and other healthcare professionals that you have to access, and you need to get your routine care through this approved network. Many of these plans, once again, include prescription drug coverage and those additional benefits. A PPO is a preferred partner organization, and this has also hospital, doctor, and outpatient care in a single plan, with many of them including prescription drug coverage and additional benefits in the program as well. A special needs program, and a SNP, is a program that's designed for people with special or complex healthcare needs. These are designed for people with residents of, or that may be a resident of a nursing home, or folks that are eligible for both Medicare and Medicaid, dual beneficiaries, or folks with certain chronic diseases such as diabetes or health disease, or as we referenced earlier, ESRD. They're not available, all plans are not available in all areas. The thing with these programs, including the private fee-for-service plans, which is offered by private companies like the rest of them, that might include prescription drug benefit, is the fact that the providers, the doctors and the hospitals, must accept the payment terms and conditions that are set by the private insurance company offering the program. The payment comes from private companies, not from Medicare. And it's important that the doctor or hospital accept the payment of the plan before you receive the services, that you know that that is going to happen. When we go in and we discuss Part D, we're looking at prescription drug plans. And these are programs that help with the cost of prescription drugs. You can only receive Part D coverage through a private insurance company. Remember, A and B is the government, Part C is private insurance companies, so is Part D, private insurance companies. And it's important to shop around when folks become eligible for this coverage and discover which plan best covers the medications you're currently taking. It's important that you must continue to pay your Part B premium while you're on a prescription drug plan as well. So some fast facts about Part D plans. What does it really cost? Because you'll want to look at a combination of the premiums for the plan itself, the co-payments and co-insurance associated with the medications you take, and whether there's any additional coverage that is part of that plan. You want to look and make certain that the drugs are on the list that are part of that program. And if you don't qualify when you're first eligible and you don't have a exception that gets you out of jail, so to speak, there will be a penalty for the cost of these plans if you don't enroll when you're first eligible. Most of the plans work to help you avoid those penalties. The formulary, well, that's a list of drugs that is offered by that particular plan. And those plans have built their specific formulary by selecting drugs from specific groups. Many of these plans will use tiered formularies to cover drugs according to the cost. So depending upon where the drug falls on the list will help determine the cost of the medication as well. Medicare does provide guidelines about the type of drugs to be covered, but not specific drugs. So there may be, for example, and I'm making a number up, 40 high blood pressure medications. The government will say you have to cover high blood pressure medications. They won't say you have to cover lisinopril or a specific medication. The company determines their own formulary, so it's important to check that list since there may be different formularies for different plans involved. And Medicare has excluded some types of drugs, but the plans may include them as part of an enhanced formulary. Those are normally plans that are a little more expensive. And the medications that aren't on that drug plans list, ain't on the plan, not on the plan formulary, well, they may not be covered or cost additional money. It's also important to talk about the coverages through the different stages of coverage and how they work. If it is a standard program that the company has not enhanced, there's a deductible, which is the amount of money a person has to pay out of the pocket before the initial coverage begins. Not all the plans have a deductible, but if the plan you select does, you have to pay that deductible before the initial drug coverage stage begins. Once that initial drug coverage stage begins, you pay a flat fee, a copayment, or a percentage of the drug's total cost, coinsurance, for each prescription that you fill. And the plan then pays the rest until your drug costs reach, in 2016, $3,310. If your drug costs go beyond $3,310, you reach what is called the drug coverage gap stage. The gap. You may have heard it referred to as the donut hole, and during this stage, in 2016, you pay 45% of the total cost of brand name drugs and 58% of the cost for generic medications. The dollar amounts in that coverage gap can change from year to year, and they do. And then your total out-of-pocket cost in 2016, once that reaches $4,850, you then move to the catastrophic drug coverage stage. Clear as mud, and it's very simple, isn't it? In this stage, once you hit the catastrophic drug coverage stage, you pay only a copayment or a co-insurance amount for each filled prescription, and the plan in Medicare pays the rest until the end of the calendar year. Some examples. It gives you here on cost of where the drugs would fall and what an individual would expect to pay on out-of-pocket costs for the year. This is where Medicare.gov can be very, very helpful in helping determine which drug cost is the best option for you. We talked about the plans A, B, or the programs A, B, C, and D under Medicare. We need to talk about the standardized Medicare supplement insurance programs that help with some of the costs that Medicare doesn't cover. These are sometimes referred to as a Medigap policy. And once again, these are offered by private insurance companies to cover some of what Parts A and B doesn't cover, meaning they'll cover coinsurance, copayments, and deductibles not covered by original Medicare. And these plans, not to be confused with Parts A, B, C, and D, are named A, B, C, D, F, G, K, L, M, and N, and a high deductible plan, F. Standardized programs set by the government in benefits. They may vary from plan to plan, and generally, the more comprehensive the coverage, the higher the premium that's associated with the plan. To be eligible for a Medicare supplement, you've got to be enrolled in Medicare Parts A and B at the time the supplement coverage begins. You've got to be a resident of the state in which you are applying for coverage. You must be age 65 or older, or under age 65 with certain disabilities in some states, and people of any age with end-stage renal disease. Some additional facts about Medicare supplement programs. There are costs that are involved, and these programs help with some of the out-of-pocket costs not paid by Medicare. And the premiums that are charged for the program they vary according to the plan and the insurance carrier. In some states and plans, premiums rise as your age increases. The enrollment into these programs, while you're guaranteed the right to buy a Medicare supplement insurance plan during your open enrollment period. And in some states and plans, if you apply after your open enrollment period, you can be denied coverage based on your health. This period of guaranteed insurability begins the first day of the month that you are enrolled in Medicare Part B, and in most states, it lasts for 6 months. The coverage itself, well, it's not network-based generally, so there are no network restrictions and virtually no referrals required by the plan coverage itself. Providers might require a referral. The coverage will go with you when you move or travel anywhere in the United States, and some of the plans actually have a foreign travel benefit for emergency medical services, generally $50,000. The coverage is guaranteed to continue as long as you pay the premium on time and you have not made material misrepresentation on your application for insurance. Translation in English, you didn't lie on the application to get the coverage. So what you have is a multitude of coverages that are available for you. You have original Medicare, the Parts A and B. You have Part C and the Medicare coverages as an option in lieu of or to help with costs that would be normally associated with traditional Medicare. What you have, however, are certain time periods in which you can enroll into the programs. So let's talk about the different parts. When can you enroll in Part A of Medicare? It's during the first 3 months before your 65th birthday, the month of, or 3 months after, or when you become otherwise eligible for Medicare. Enrollment's automatic if you're already receiving Social Security benefits. Otherwise, you'll have to enroll at a local Social Security office. If you are on disability, you also become eligible after your 24th month of receiving Social Security disability. Your IEP is the first 3 months before and the 3 months after the 25th month of your disability. If you're late, well, generally there's no penalties for signing up late for Part A. You may pay a penalty on your premium for signing up late if you're one of the people who pays a monthly premium for Part A because neither you or your spouse contributed enough into Social Security as you were working, had enough quarters in. If you enroll in Part B after the initial enrollment period, premiums will be higher by 10% for each full 12-month period unless you qualify for an exception. Medicare can speak to you concerning these exceptions. You have an example of that you can go through in the presentation. And then when are you first eligible for parts C or D? There's a 7-month window of eligibility. So generally you can first enroll 3 months before your 65th birthday month, your birthday month, and 3 months after that birthday month. 3 months before, the month of, and 3 months after. If you're late, you must wait to join the program until an open enrollment period, which is between October 15th and December 7th, or unless you qualify for an exception, such as a special election period. We love to call them SEPs. If you work past the age of 65, well, you can enroll in Parts A and B, but you may choose to enroll in Part B later, delaying that enrollment, since there is a monthly premium cost. You need to contact your benefit administrator at work to find out the options you have and how your coverage at work deals with and coincides with Medicare. When you retire, you can become eligible for a special election period, that SEP we referred to, and you can sign up for Part B without penalty. And this Part B SEP will run for 8 months and begins the month after your employment ends. If you enroll in Part B after the 8-month SEP, you may have to pay that late enrollment penalty, and you'll have to wait until the next general election period, a GEP, a GEP, to enroll. Med-Sup plans. You can first enroll in a Medicare supplement program during the insurance open enrollment period, which begins the first day of the month and that you turn 65 and are enrolled in Medicare Part B. In most states, this period lasts for 6 months. Some states allow ongoing open enrollment, and some states require that the coverage be offered to people who are under the age of 65 and eligible for Medicare due to a disability or end-stage renal disease. An individual can drop a policy and apply for another whenever they like, but they can be charged a higher premium or refused entirely for that coverage. If you're late, if you miss a window, you can apply later at any time, but you may be charged a higher rate or be rejected if you have a health history that makes you appear to be a higher risk. So for your next steps, let's talk about what you need to do to choose a plan that is a good fit for you. Let's look at reviewing the enrollment period. So understand when you need to qualify for the coverage or when you qualify for the coverage. Second, let's do some research. Let's compare the plans and find the coverage that's the best option or a good option for you. And let's ask some questions. Ask the important questions about your medical needs, such as, do you take prescription drugs regularly? How frequently do you generally need care? And get the answers to those questions. There's a ton of free resources available to answer all of your questions. You can visit MedicareMadeClear.com, Medicare.gov, or the Social Security Administration's website, SSA.gov, SocialSecurity.gov. Look and see also if there are financial programs available if you qualify for those assistance programs. Social Security office and the state Medicaid office can help you, as can qualified insurance agents, by the way. And then you need to enroll. You need to know what plan type is right for you. Go online to Medicare.gov's Plan Finder to see what plans are available in your area. Great program to figure out what is your options in your area. And then review those programs each year. Mark the calendar and make any changes to your plan if needed during the Medicare open enrollment period, October 15th through December 7th of each year. So, once you're covered by Medicare, how can you possibly save some money on healthcare costs? Well, we went over the Part D coverage a bit earlier. And if you and your plan spend more than $3,300 in prescription drug plans and you enter in that donut hole, you may be asked to pay most of the cost of your prescription drugs. If you reach this stage, you might be able to save money by talking to the doctor to see if the medication you're taking has a generic or a lower tiered drug option. Remember, the government says the plans have to cover drugs in a plan type. They don't specify which drug and in which tier it is covered. So it's important to make certain that we utilize preventative services to save money in the long term, and that if you are in a plan that has a network of both doctors and pharmacies, we adhere to that to save the money. When you go then to think about when you compare plan options and some very, very valuable questions to be asked during it, well, year over year, has your health circumstances changed? Have your finances changed? Did you move? Are you going to travel a lot? Are your doctors and hospitals and networks? Are all your prescriptions covered? Could you benefit from coverages that give you additional help for like gym memberships, drug help, routine dental care, hearing aids, etc. So some different things. So you can find information in a number of areas. MedicareMadeClear.com is United's healthcare with these pieces of information as of breaking the third wall, fourth wall, whatever it is. As agents, we can sign up for that. They send really neat updates to you and a good way of accessing additional information about Medicare to stay in the loop. United Healthcare also stages a Medicare Education Week each year in September from the 15th to the 21st, and this is a great way to help educate yourself on different programs regarding Medicare as well. And then, of course, there's a ton of resources on Medicare.gov, which is the official United States government website for Medicare, or you can call them at the 1-800-Medicare number. There are also SHIP programs or SHAP programs, state health insurance assistance programs, that might help with an individual to see if they qualify for financial assistance as well. So this is a program that United Healthcare offers as a presentation that as you practice, you can flow through pretty easily. And that is available through their website. Then, of course, you have the different programs that are available off of CMS's website as well, including not only the presentation, but, hey, workbooks as well. The challenge with this is you can pass out these workbooks. Have you noticed any place where you can go to order them? Nope, there isn't. And if you did, you can take this and take the PDF of this and print it. That's a out-of-pocket cost for the programs. The government doesn't cover it for you. Many people also will use another tool to help explain Medicare, but is one that doesn't flow quite as easily. And if we go to Medicare.gov, this is where you can use some of the plan comparison pieces that we talk about. There's also different pieces that are available as well, informational pieces available on the website here. And what you can do is, bear with me a half a second. You can use some different things on publications and other pieces, but this is a piece that is sent each year to people that are on Medicare. And that's the Medicare and You guide that is available. It's available in many different formats. Unless specified otherwise, people on Medicare receive the standard piece, but it's available in English or Spanish, and also available in English and Spanish in large print. When you look at this program, it is a very comprehensive guide, and I've heard some insurance brokers refer to it as the Medicare Bible. Updated each and every year, available to you each and every year, and I got to tell you, it's comprehensive. It's also a great sleep aid in certain circumstances if you want to read through it, and that's why we use some of the other material that is a little more abbreviated. 160 pages, and it lays out all kinds of information for you to find on site. Obviously, you can use the Medicare.gov website and search for some specific answers too, but this, for anybody who is just getting in the Medicare business or just coming on Medicare itself, boy, it's worth the investment of time to read through and become familiar with the different topics and pieces of information that are available for you here. It is a tool that many folks will use to sell other programs. What do you mean by that, John? Well, long-term care. A lot of folks thinks that Medicare covers long-term care. Nope. Short-term for a SNF unit, a nursing facility, transitioning out of a hospital stay with traditional Medicare. Long-term care is not covered by Medicare. If the person's assets fit the qualifications, it sometimes is covered by Medicaid, but that's a different animal entirely. So it's a great way to reference other types of programs as well, and gives you the opportunity to have the Bible of sorts right in your hand, and it walks through some of the information that we spoke to as well. We do have a supply of these on hand and do use these in different presentations periodically, but obviously it's 160 pages. It doesn't flow all that well in the course of a presentation. I would strongly recommend that anybody who runs Medicare appointments or meetings or references material about Medicare have one of these copies available as part of their presentation binder in their briefcase so they can use it for reference purposes. Great tool that's available to you, a piece that you really need to use. So you have then available to you as pieces of information carrier websites such as United Healthcare's piece. Aetna has the same, much of the same material, just not some of the marketing material. Humana, all the carriers that do Medicare business will have that, and some are just a little easier to work with. Some are perhaps a little more cost efficient in supplying those materials to you. So you have information available from the carriers. You have medication or information available from Medicare.gov and from CMS.gov. Social Security website can be of help to you as well. So what you have in this circumstance is information that you can use to educate yourself, and depending upon the approved presentations that we've mentioned as well, information that you can use to educate the public. Why would you want to do that? Well, establish yourself as a subject matter expert, and you can go into the community and speak to groups and generate lead flow in that fashion. Knowing the special election periods, knowing the enrollment periods, knowing the benefits and strengths and weaknesses of each of the programs then can make a huge difference on, one, how you're perceived, and obviously how you do business. It affects not only your reputation but your persistency and your income. So you've got some different material that's going to be available to you. We are going to send you a link to today's presentation for you to review, because John is on a little caffeine and has rolled through this presentation about 10 minutes faster than he anticipated. But you'll get that follow-up, and you'll also get follow-up with links to some of these materials that we have referenced during the presentation today. Another piece that I'm going to suggest as another reference site, dramatic pause, computer thinking, it's theBrokerageInc.com. You have a ton of reference material here too from our organization, and we would welcome the opportunity to help you with your Medicare questions and your Medicare business. I want to thank you for coming on the line and spending some time with us today. Watch for the follow-up to today's presentation. We'll get some different things out to you. If you have some questions, 1-800-442-4915. Local number here in Louisville, 469-635-6000. Obviously, you can use that anywhere, but hey, want to save a dime and you're outside the area, 1-800-442-4915, theBrokerageinc.com. We look forward to speaking with you very soon. And hey, good selling.